everyone, and welcome to my first lesson about TMS, Tension Myositis Syndrome. First of all, I apologize for the quality of this video. It's my first video. It's by no means professional, but I thought that getting some information out there is better than nothing at all. So I hope that this video will help you in some way if you're interested in TMS and in learning more about it. So what is TMS? TMS is a condition discovered by an American doctor, Dr. John Sarno. He used to treat plenty of patients with back pain, and he was very disappointed with the results, mainly because most people couldn't get rid of their back pain. Sometimes they had surgery and that worked. Sometimes they had surgery and it didn't work. So he just couldn't figure it out. And then eventually he started noticing certain common traits between his patients and their personalities. Some of them were very ambitious, very sensitive people. Some of them had gone through emotional trauma. A significant event just before their chronic pain started, and he tried to investigate this further and basically discovered and came to the conclusion that all of these people were suffering from TMS. And it doesn't just have to do with back pain, but it has to do with a lot of chronic pain conditions that keep recurring in a person's life, that have no obvious reason, as in there's no obvious injury, or if there is an injury, it just can't get better. And he figured out that what these people were suffering from was an emotionally triggered physical reaction. And when I say emotionally triggered, it means that something happened in their brains, they reacted, and the pain resulted as a reaction. This doesn't mean that the pain was all in people's heads. What it means is that basically their emotions were keeping certain pain patterns alive. So as an example, I could mention someone who's got a speech to make and he's very nervous. And I'm sure you've been in these kinds of situations. You feel really nervous. You're going to make that speech. And as soon as you step up to speak out to the public, you feel your heart beating in your chest and in your throat. Basically, that heartbeat is really a faster heartbeat than normal. But the reason for that heartbeat is not because you've run a marathon, but because you are nervous and tense and excited. So that's an example of having an emotion, so like fear or excitement, causing an actual real physical reaction, which is the increased heartbeat. Now, in TMS, the difference is that the pain is kept alive. So unlike the speech situation, when eventually your heartbeat gets back to normal because you're out of the situation and it's over, people with TMS tend to keep the pain alive because they keep repeating the same emotions, the same thought patterns that they're not even aware of, because this all takes place in the subconscious mind. And basically, there's some conditioning involved, which I'll deal with in a later video, which means that the person automatically starts creating these reactions, these conditioned responses. So there's a thought, or maybe not even a thought. Maybe the person isn't even aware of this, and the pain comes up. That's why people with chronic pain tend to have certain patterns, like more pain in the morning and less pain in the evening, or vice versa. And they tend to have flare-ups. So the pain isn't consistent all the way through for some people. And basically, that's it. If you're willing to explore TMS further, just keep a lookout for my next video. I'm a holistic life coach and mind-body practitioner specializing in TMS coaching. And I hope to see you in the next one. Bye.